Hello, welcome to Health Talk. I'm Dr. Manny. Autism affects an estimated 1.5 million Americans, and with no real cure, many parents are left searching for answers. Joining me today is Dr. Ron Leaf, co-director of Autism Partnership and author of this new book called Behavioral Treatment of Autism. This is a fantastic book. Doc, thank you for coming to the program. And I want to tell you one thing right from the beginning. I have an autistic son. And my son is 11 years old, and his autism, which was diagnosed at the age of 2, has become one of the most important things in my life and the way I look at my life today. So this is a very personal story for me. Tell me about, some of the false hopes, because that's, I think, is one of the biggest issues that parents go. Are we going to find a cure? Are these children going to get better?
I wouldn't use the term cure. I'm not sure if we're going to find a cure, but I think we certainly know what good treatment can be and the effectiveness of good treatment. And I think we're finding more and more today that the prognosis is very hopeful for children with autism, given they get the right treatment.
Right. Now, when I talk to my wife and we kind of say cure, we don't even know what we're saying to ourselves, right? Because what is normal? I don't know what normal is anymore, especially having a child with autism and having 2 other children that do not have autism, because I look at my autistic child and I think he has incredible, unique characteristics that could be quite wonderful in this world. What are the newest treatments for autism that you're dealing with?
Well, the treatment that I do is called applied behavior analysis, and I've been doing this for 35 years. It's a treatment that's based upon the premise about learning, and that we have to be systematic teachers of children with autism and teach them how to communicate and how to play and how to develop meaningful friendships. And it's not a new treatment. It's been there for a long time, but it's become much more prominent in the field of autism.
Now, many parents wonder, because we look at the statistics, I think it's 1 out of 150 boys that are being diagnosed every year with autism. Are we seeing more autism today because of all of these environmental factors? I mean, we get into the debate of vaccines and plastics and baby bottles and you name it. How true is all of that?
Well, I refer to it as an increase in prevalence, not necessarily incidence. More certainly being identified today.
What's the difference for the audience between prevalence?
The difference in prevalence is that there's more identified, more diagnosed today. We don't know if there's really truly more children today with autism. There could be, but we're not sure. The changes have to do with the change in the diagnostic criteria. It's widened dramatically in the last 15 years.
So is this glamorizing the disease? I mean, I see there's a lot of, celebrities out there. I mean, I saw some celebrity, which I don't want to name, in a very militant way, saying, hey, I know why my child has autism, therefore don't do this. What do you think about all that?
Well, I think there's good parts to it, that it's out there. People are learning more about autism. They're seeking treatment. That's the advantage. The disadvantage is there's quite a bit of myths about treatment. There's what we call the cure of the year. It used to be the cure of the year. Now it's the flavor of the month, where every month there's a new treatment out there with no scientific evidence.
Give me some of those myths that people have been exposed to in the past.
Well, I think there's myths in terms of prognosis. I think it's often been thought of as a very devastating disorder that really can't improve, and that's really not true. I think there's myths in terms of the etiology of autism. We really don't know what the cause of autism is today, but there's a lot of myths like the vaccine that's a cause of autism without any scientific evidence to show that. And then there's tremendous misconceptions and myths about treatments. There's hundreds of treatments on the internet today you can find.
Chelation, for instance.
Exactly. With not any evidence, scientific evidence showing the effectiveness of it. Sensory kind of treatments, again, no evidence of the effectiveness of them. The curious thing is applied behavior analysis that's been treatment for 40 years, thousands of research studies showing the effectiveness. The American Surgeon General recommends it as the top treatment. Those things just aren't as glamorous, because they're hard work.
Right, which is, by the way, my child does undergo your therapy, and not with you particularly, but under the same principles. And yes, it's a slow-moving process, but there is change. As time goes by, there is change. And when change occurs, you can have better communications. Any diets? That's another myth that people, go out there and at least talk about. Any specific diet that you like more than others?
A good, healthy, sound diet.
Right.
In terms of things like casein gluten-free diets, again, limited scientific evidence. If a child has allergies, however, and is not feeling well, then certainly it's important that their diet is regulated so they feel healthy. But in terms of long-term effectiveness, diets have not proved to be effective at this point.
One of the things in your book, you do mention, because I tended to do this as a mistake at the beginning, especially when my child was diagnosed. I did not, I didn't accept it, the diagnosis, and one of my tendencies was to put him on with other normal children, or quote unquote normal children, and one of the things that you talk in your book is that integrating a child very early on with other kids that do not have autism really is not necessarily the best thing to do.
It depends on the child. If a child is operating at a level where they can learn from models, then it's wonderful. It really depends on the level. I liken to skiing. You'd like to ski on black diamond runs, but that doesn't necessarily mean you start there. If you're very athletic, could happen. But sometimes you have to start more basic level and get the foundational skills. And a lot of our treatment is designed for that. But we want to move children as quickly as possible. And certainly there's children that we immediately put with other children, and there's sometimes they're not quite ready for that yet.
Final words, where are we with autism today?
I think we're in a very good place. I think we're understanding that the treatments are out there that are effective. I think it's a much better day to have a child with autism.
Okay. Well, thank you so much for your wonderful insights. Thank you so much for the contribution for this book, because I think it's going to bring new light into the therapies that are available and are working for children with autism.
And thank you so much for having me.
And if you have any health topics you want to talk about, email me here at Fox at drmanny@foxnews.com. Until next time, I'm Dr. Manny.